It's February 18. Ukraine Media Center continues its operation. My name is Svetlana Chaparenko, and now we will be talking about the current situation with ARVI diseases and influenza. And joining us in the studio is Oleksii Danylenko, Deputy Director General of the Public Health Center at the Ministry of Health of Ukraine. Good afternoon. Good afternoon. The microphone, please. So let's talk about the epidemiological situation and those strains of ARVI and influenza currently existing in Ukraine. How dangerous are they and how are they manifesting themselves? Well, first of all, I would like to mention that for the time being, it's safe to state that the epidemiological process is developing under a classical scenario, and this year is no different from other years, the previous years, the previous season. Talking about the statistics, about the number of people who contracted the diseases starting from the 15th of September during this epidemiological season, currently we've documented about 2,500,000 cases, but please don't be frightened by this number because during the previous season we had even bigger figures. So currently, during current season, the figures are 16% lower than during the equal period of the previous year. When it comes to the reporting week, meanwhile, we analyze the statistics on a weekly basis. Now we have information as of the 7th week, starting from the 10th to 16th of February. We've documented 206,000 cases. When it comes to the regions, all of the regions can be divided into a number of subclusters. In some of them, epidemiological threshold was not achieved, and in others, it was already achieved, but they can be again subdivided into subgroups. So what are the regions that didn't cross the epidemiological threshold is Donetsk, Dnipropetrovsk, Zaporizhia, Mykolaiv, Kharkiv, Kherson regions, Chernihiv, and the city of Kiev. In those regions, the level of contraction has not achieved the epidemiological threshold. And when it comes to the regions that cross the epidemiological threshold on a low level, it was documented in Kiev, Vinnytsia, Kirovohrad, Odessa, Poltava, and Sumy regions. The medium level crossing of epidemiological threshold was documented in Rivne, Ternopil, Zakarpattia, Cherkasy, and Chernivtsi and Lviv regions. And in one region, it's a high level of threat. It's Khmelnytsky region. There's the information with a breakdown by regions in terms of their achievement of epidemiological threshold in our country. Well, out of those 2.5 million who contracted the disease, what is the percentage of the children and what is the percentage of the adults? So talking about the division into age categories within the reporting week, 60% of those who've contracted the disease were the children. Yeah, the children account for 60%. So how does the influenza and ARVI manifest themselves during this season? Well, the manifestations are not different from other seasons. We are all aware of the symptoms inherent in influenza and ARVI, like respiratory manifestations, sore throat, fever. But first of all, if you feel any such symptoms, please don't postpone your visit to your family doctors so they could identify the treatment and provide the necessary medical aid. So how can you get protected against ARVI or influenza? So first of all, I would emphasize the most efficient prevention methods such as vaccination. It applies both to COVID and influenza. Talking about flu vaccine, it's available in the pharmacy chains of our country. Any citizen of Ukraine can buy a vaccine at their own expense, or it can be provided at the expense of the employer or the local governments, who can also procure the influenza vaccine to get the population of their community vaccinated. The vaccination is not mandatory, that's why it can be bought on a commercial basis from the pharmacy chains. When it comes to COVID vaccination, such vaccine is available throughout all of the regions. It comes for free. Any citizen may report to the vaccination cabinet, to the vaccinating doctor, and again, I would urge everybody to use this method because it's the most efficient method to prevent this type of diseases. There are other methods that can also help in prevention of this type of disease or in their spreading. First of all, it's about washing your hands. Another efficient method is the use of the personal protective equipment, avoiding of staying in the areas of mass concentration of people. In case you feel the symptoms, please stay at home. Don't pose a threat to others. Don't expose your colleagues to the threat. So those are the basic methods that are easy to comply with, but still they're efficient. Okay, when it comes to COVID, what is the number of people in Ukraine currently suffering of COVID, and how does it correlate with the previous year? How does it compare to the previous year? Well, less than 18,000 persons contracted COVID starting from the epidemiological season. Comparing to influenza, it's less than 1%. So this is the correlation. Well, you've mentioned such numbers that among all of those who contracted influenza and ARVI, 60% account for children, and some institutions are already imposing quarantine measures. So what are the preconditions for such measures? Well, it's the up to the local authorities whether to implement such measures or not. Every region has the regional center for diseases and epidemiological control. They are responsible for monitoring of the influenza and ARVI level in their region, and in case of deterioration of epidemiological situation, they take necessary steps, including reporting to the regional committee on epidemiology, who is responsible or who is entitled to make decisions which are mandatory for implementation by all of the institutions and organizations that are responsible for prevention of spreading of influenza and ARVI. That's an efficient method, and when it comes to its efficiency, it's proven by the fact that as of the 4th and 5th week, the level of contraction among the children was higher than during week 6, because some of the regions have already implemented the preventive measures that proved to be efficient. And again, such prevention measures can be used not only in those regions where the epidemiological threshold would be achieved, but also in those regions where the threshold was not yet achieved, but On a local level, in an educational institution, the epidemiological situation in terms of influenza and ARVI might have been deteriorated, and relevant prevention measures might have been imposed in a separate educational institutions. Well, you've mentioned that Khmelnytsk region is basically the leader in terms of disease level, but what is exactly the statistics there, and what are the other regions that may implement such measures? Well, the measures are being implemented upon the recommendations of the Centers for Diseases Prevention and Control, and I think that relevant measures may be implemented if they are not implemented just yet. What is your forecast? Is the number of people who contract the diseases is going to grow, or the prevention measures are about to yield positive results? Well, I've already mentioned that this year the scenario is classical, and comparing to the epidemiological season of the last year, we're observing the similar process dynamics with lower indicators of the contraction level. We're moving with a difference of indicators, with indicators lag for a week period. But if we compare it to the previous year, shortly the contraction level is about to subside. Thank you very much, Mr. Oleksii. Dear journalists, do we have any questions on the floor? Well, if we don't, once again, I would like to thank you, and let me remind our spectators that we were discussing the current influenza and ARVI situation, and Ukraine Media Center will continue on Thursday. Thank you for staying tuned.